Okay, welcome everyone. I see there are some people signing on. We're going to give people a few moments to join us. And for those of you that have joined us already, my name is Miriam, and I'm one of the owners at Fit for Life Physiotherapy. So I'm going to be here kind of as your moderator today. And checking the chat, making sure that all the questions are answered. So if any of you do have questions throughout, make sure you know where the chat button is it's usually down at the bottom. So at any time throughout the webinar, if you have any questions, please put them in the chat and I will do my best to keep on top of that and let Tamara know when we have questions. I do find that for some reason, the question and answer box doesn't always open for me. There's my issues with technology sometimes for some reason, I don't know. So just put your questions in the chat box is the easiest. We're really happy to have Tamara talk to us tonight about yoga therapy. Tamara and I met now, how many years ago is that? Is it 7?
It would have been 20, the tail end of 2013. And then
okay. So yeah, so Tamara and I were doing our yoga teacher training together. So which is where we met. And soon after, we discovered that we wanted to have a kinesiologist at our clinic, and I thought it was a really great fit to have somebody who's also trained in yoga, because it is something that I personally incorporate a lot of in my practice. And then Tamara's gone on to do her yoga therapy certification. So we're really fortunate to have her with us. She's somebody that really has a keen eye for movement, and I feel really confident when I want to send my clients to get some further instruction and exercise, whether it's yoga based or not. She's great at helping people break down the exercises and figure out something that works for them. So I'm going to pass it off to you. I will stay silent unless I need to jump in to tell you that somebody's asking a question.
Okay, that sounds perfect. All right, well, thank you everybody for joining myself and Miriam tonight. I'm really, really excited to share with you more about yoga therapy. And so, as Miriam said, if you do have questions, I have a few spots that I've put some pauses for questions. But if things come up as we go along, again, please feel free to type those out, and I will do my best to make sure that all of your questions get answered before the end of the presentation. So we're talking about yoga therapy this evening, and specifically how it can help you build resilience and vitality. And a little bit more about me. So as Miriam mentioned, I am a registered kinesiologist, and I did my schooling at McMaster. And not too long after, but a few years after that, I did my first yoga teacher training. And then this past year, I have completed my yoga therapy certification, which was a process about probably 4 or 5 years in the making. There were several stages and steps to it. And yeah, it was a great process. So some of the activities that I like to do, I grew up dancing. After university, I got into running, yoga. I like to go to the gym. I dabbled in CrossFit and some weightlifting. I love hiking, going to the cottage. So all sorts of activities that I like to participate in, and I like to try new things as well. I'm pretty good at taking care of people. I'm not so good at taking care of plants. I'm working on my green thumb, and hopefully one day I'll figure out how to take care of all of the plants in my life, but I'm not quite there yet.
I'm with you on that. I'm not very good at it. I'm really good at buying them and bringing them home, and not very good at watering them. My husband does that for me.
I tend to either overwater or underwater, or I don't have the right light, but luckily I have a few friends that I can rely on when I'm struggling. So how did I find yoga therapy? So I found yoga after university. I was looking for something to take the place, or there weren't any adult dance classes that I could find, and I was looking for something to do. And so I found yoga and I really loved it. I, you know, started going to yoga classes quite consistently. I felt great doing the practice, and became interested in teaching. And so throughout all of this process, what I also noticed is that a lot of the students around me, some of the teachers that I was working with as I became a teacher, were in a lot of pain. So they were either taking classes or teaching classes and having a lot of issues. So there was a disconnect for me, and I could feel and I could see all of the benefits of yoga, and I wasn't really sure how I could bring that into my practice as a kinesiologist in a way that really benefited my clients. Um, so that led me to some explorations and kind of, looking out there what was available. And through some other teachers at the studio who had similar interests to myself, was introduced to Susie Hately, and she's who I completed my yoga therapy certification with. And so that's how I found yoga therapy, and it truly has changed um, the way that I practice yoga. It's changed the way that I teach yoga, and then it has allowed me to integrate all of the benefits of yoga into my practice as a kinesiologist. And then I also feel that I bring my expertise in movement as a kinesiologist to my yoga practice. So it's been a really, really amazing journey for me. And of course, it continues. I'm always learning more. And yeah, I'm excited to keep learning more. But that's kind of what's gotten me to where I am now. And so you're probably wondering, what is yoga therapy? Hopefully, that's partially what brought you to this webinar. So, yoga therapy is an approach to movement and healing. It incorporates movement, stillness, and breath. So, those are the main tools that we're using if we wanted to kind of clump them in. And it aims to improve underlying movement patterns to get to the source of an issue. So, we're not looking to just kind of slap a band-aid of relief on whatever is going on. We're really looking to get to the root of what is happening so that we can help you feel better long term. And it's an approach that considers the whole person in terms of your healing and well-being. So it's really not just about how you're moving. It's not just about the breath or one piece. It's about the whole person. If you've had a shoulder injury, how is that shoulder injury impacting the rest of your life? How is it impacting how you're feeling about yourself, your movement, and what you can do? So I really love that, and I think, Miriam, you can probably speak to this as well, that like a physical injury is not just impactful on our physical being. It's so much more than that.
Yeah, absolutely. And I think vice versa, in the sense that, the stress
Mhm.
around us and the emotions around us can have an impact on our experience of an injury and of the pain that we're experiencing. Absolutely.
Yeah, yeah, absolutely. So yoga therapy is really incorporating all of that, and then considering the individual. That is, so when I'm working with somebody, it's like the person who is right in front of me. What are their needs? What is their personality like? What are their goals? So it really is, I think, this beautiful way of incorporating or really individualizing care. And it really is just, it's about the individual client. And so yoga therapy can help or address all sorts of issues or concerns. Pain relief is a big one for people. And this can be different types of pain. So persistent pain or more um, long-standing issues. I have somebody that I'm working with currently, and she was experiencing the same pain for 13 years and didn't think that we could have any effect on it. And that's actually not even the issue that she came to see me for. But we were able to get her some relief in that. So persistent chronic pain, recurring pain. So if you have um, maybe an area where it doesn't always bother you, but you'll kind of get these ebbs and flows where you're kind of having a flare up and then things calm down, flare up and calm down, and you kind of can't get out of that cycle. And then just pain in general. So if you've got back pain, hip pain, shoulder pain, you name it, it is certainly something that yoga therapy can address. And then injury recovery and return to activity. So as Miriam mentioned, um, I will see clients sometimes who are working with a physiotherapist, or as they're kind of getting to the towards the end of their physiotherapy treatment, who are looking to get back to their favorite activities after an injury. So, for instance, I've worked with clients who are looking to return to running after having children and experiencing pelvic pain. Clients who are looking to get back to work after they've had a concussion, returning to gardening, working with clients pre or post knee or hip or shoulder replacement or surgery. So there's a lot around as a client, your activity goals, and what are you looking to either return to or progress in. We could put it that way. And then there's also this piece of managing diagnoses, and that can be a pretty broad category. But for instance, migraines, arthritis, osteoporosis, MS, fibromyalgia. So when there has been a health diagnosis that it's not really going away, we can still have a lot of impact within that circumstance. So we know that if we take the example of osteoporosis, not everybody who is given that diagnosis presents exactly the same or will have the same roadblocks. And so yoga therapy can help you within your circumstance, that you can thrive within that and feel really good. Burnout. This is another really good one. So when you just hit that wall and maybe you're not feeling a specific, a specific pain issue, but just generally you're feeling, bogged down, you're not feeling yourself, you're feeling like you can't keep going, that the pace of things is just too much. This is something that we can address with burnout. And I've kind of touched on this next one a little bit, but improving your performance. So really, if you have any activity related goal, yoga therapy can help you with that. Now, it may not necessarily be getting some of the skill development. So let's say if you had a certain sport, let's use golf as an example. I just finished a yoga for golf. So though I am not a golf pro, what yoga therapy can help you with is all of the underlying movement patterns that will help you to really excel at those skills. And so if you are working with a golf pro, or perhaps you're just on your own looking to improve your golf game, then we've got all of the movement patterns in place so that you can go forward and you can get to where you're looking to go to. And then the last one that I've put here is managing stress. And I think that is something that a lot of us, especially over the last, 14, 16 months, have, experienced perhaps to a higher degree. And when it starts to run the show, when you start to feel like stress is in control, that's where a lot of the tools that yoga therapy has to offer can help you to manage that stress and feel better. And it's not that, you know, things aren't going to happen. Life is life. We know that bumps in the road are going to come along the way, but rather that you can feel that you manage those bumps in the road better, that they don't kind of send you flying off course. And I think that's really important. I know for myself that has been a a really beneficial part of practicing both yoga and then getting a little bit more specific with the yoga therapy, right? You know, I'm sitting in a traffic jam and all of a sudden I can be calm and working on my breath work rather than wanting to scream at scream at whatever is going on around me. Um, so those are some of the issues. That's kind of a broad stroke of what yoga therapy can address. And then yoga therapy can help a whole host of people. And I think one of the most important things is that yoga therapy is an active approach. So there are instances where in clinic, you know, if I'm working one-on-one with somebody, we might be doing some hands-on assistance, but a lot of it is really me giving direction to the client. So an active approach to your wellness, and it's really collaborative as well. So we're working together to get you to your goals. There's a lot of feedback. I ask a lot of questions while we're in a session together, and we work through things together. So I think that's really important. Yoga therapy is there to help anyone who is open to that kind of active, collaborative approach. And I also think it's really for people who are looking for the root of what's going on. So if you're looking for more than just relief or a band-aid solution, but you're really looking to feel better long term and understand how to take care of yourself long term, that's where yoga therapy can come in. And really, yeah, anyone who's looking to feel better, reduce pain, or improve your movement. And I think being open to what yoga therapy has to offer is a big piece of that. And of course, if you are here at this webinar, then my guess is that you're open to at least hearing about what it has to offer. And the big question that I get is yoga therapy only for yogis or people who have been practicing yoga or who are interested in yoga? And absolutely not. So yoga therapy can help anyone who is open to it. And it doesn't even necessarily involve traditional yoga poses. We certainly take a yoga approach to things, but there are clients that I've never done a traditional yoga pose with in their sessions. And here they are feeling much better and racing towards their goals. So any questions? Have any questions come up so far? We're looking.
So Tamara, I think I know the answer, but just in a clarification as far as, because when you say a yoga approach, right, for somebody else might not. So what does that really mean? Because it doesn't necessarily mean that it's going to be yoga postures per se.
Yes.
Right?
Yes, perfect. Thanks, Miriam. That's a great clarification. Yes. So what I mean when I say that we're kind of coming from a yoga approach. So we are incorporating the whole person. We are incorporating, you know, breath work. There might be some meditation pieces. So things that we might traditionally associate with yoga are still part of the practice, although it may not be a typical yoga pose. Does that provide some clarity?
Yeah, I think so. And I guess, you know, even sort of the yeah, I mean, it's sort of yoga being union and sort of, you know, some mindfulness to how you move and breathe and all of those kinds of things, and putting that focus to it for sure.
Yes, yes. And I think that's great. That's perfect. Like, you know, I think even in our teacher training, there was some discussions about like, okay, well, what is the difference between exercise and what's the difference between exercise and yoga? And so, like Miriam just mentioned, that mindfulness, focus on the breath and really feeling what's going on. That's a big piece.
So now I hear somebody's just posted a question, and I'm not sure if you have an answer to this or not. Is there any way that I can stop histamines from being released as soon as I begin exercising or yoga? I do eat low histamine foods, but do not take antihistamine medications unless on a trip and there are outdoor allergies happening.
Yeah, that's a great question. So I'm going to circle back to this question, because I think that perhaps in the next section, as we go through how yoga therapy, kind of what it looks like, what the process looks like, that we might get there. So I will circle back to that and see if we can provide a more clear answer. Okay. All right. So here we go. Carrying on. Okay. So how does yoga therapy work? As I mentioned, we're working with the physical body, we're working with the nervous system, or we're having an impact on the nervous system. We've got a piece of the mind and the spirit as well. So again, we really are looking at that whole person experience. And mind and spirit, like if those words aren't kind of working for you, you could also think of integrating that emotional, that individual, that person into treatment. And so what we're looking at is we're restoring harmony and relationships between parts of the body. And with that, we're improving motor control and coordination. And I think this is an important piece that often we can associate when there's a problem or when there's pain, that it means that there's weakness and we just have to strengthen muscles. And sometimes it's not about just strengthening the muscles, but it's about improving the communication between our brain and whatever joint we're looking at. So perhaps it's the shoulder or the hand or the hip. So how the pieces are actually working together. And then it also, yoga therapy acts on the nervous system, and it can help us to build a more responsive nervous system. So if you're familiar, we've got kind of a few states in our nervous system. We can be in a state of fight or flight, which you've probably heard of, where we're very alert. If you've just been scared, or let's say something intense has just happened, you just hear your window break, you're probably going to go into fight or flight. Then we've also got rest and digest, where we're feeling calm and relaxed. We've got a freeze state. And so we don't really want to get stuck in any one of these states, and they all have their place. And so yoga therapy and this practice can help us move more easily through them, and to become aware of when we're in which state, so that we can start to have an impact on how we're feeling and what's going on. And it empowers you and helps you to tune into the knowledge that your body holds. So I think that we have so much knowledge of our own bodies, and we can sometimes be encouraged, or we've learned along the way, to let go of that and not acknowledge how much we know about what is going on. And so yoga therapy really helps to bring that up and help you to feel your body knowledge and what is happening in yourself. And so part of this is kind of opening a door of possibility to a different way of feeling. So for somebody who's been in pain for a long time, how does it feel to be in less pain or to get rid of that pain? We're providing an experience that kind of opens the door for the nervous system and the body to say, like, okay, this is something that's possible. and we work with the nervous system, or that's our intent, is to work with the nervous system rather than kind of pushing and forcing against it. And I mentioned this before, so it doesn't change your diagnosis or the circumstance that you might be in, but it can change how you are within that. So it can help you manage and feel better within whatever your life circumstance is. And then it provides you with tools and skills so you can become your own best resource. And I think that this is so, so important, because in becoming your own best resource and in tuning into yourself, not only will you gain, um, you will be able to intervene and you'll know what your body needs. You'll also know when you need to seek outside help. So, when is it like, okay, I need to call Miriam and I need to book a physiotherapy appointment, or this really does, like, I need to check in with my doctor or osteopath, or, massage therapist. There's this whole host of people that we can have helping us. And yoga therapy can help you to know when you need to access those different tools that you've got. And we've kind of touched on these, so we'll go through briefly. So ultimately, how does that help you, right? Like, what does that do for you? So it reduces pain and improves your performance. It builds your inner scaffolding and your inner resource so that you can manage stress and anxiety with more ease. And again, it gets to the root of the issue so that we're actually addressing the problem that is, rather than kind of skirting around it. And then it allows you to intervene earlier and earlier to help reduce flare-ups and symptoms. And here's where we'll start to come back to that question about exercise and histamines. And so I think there's a lot of power in us tuning into what's happening in our bodies and feeling what's going on, and then learning to do that on more and more subtle levels, excuse me. And then again, it will help it, all of those things help us feel more capable, confident, and knowing. So it's really empowering the client. Okay. So what does the process look like? And this is really what the one-on-one process looks like. It will be a little bit different in a group program setting. So we talk about your goals. So what are you looking to achieve from our work together? What's your health history? What is the issue getting in the way of you doing? If you've got a shoulder injury, maybe it's that you can't brush your hair, or you can't pick up your grandchildren, or lift your groceries, right? Those are all things that we need to address as we move along. So once we've established what the goal is, where you want to get to, we take a look at your movement. So what is moving well? What's not moving so well? What are the pieces that are involved that we'll need to start to bring into the mix? And then we break down these movements and we improve the relationships of the parts. So this has a few layers to it, where we're growing your awareness through movement. We're growing your capacity to feel what's actually happening in your body, and we're quieting the compensations. And as we quiet compensations and we allow the parts that are supposed to be doing the work to do the work, and the parts that are supposed to be, resting or quiet, be quiet, then things start to really improve, and they can improve quite quickly. And part of that process is identifying your yellow lights and what is happening before your symptoms and the compensations actually come up. And so, what are yellow lights and why are they important? So, your yellow lights are those little whispers, those things that start to come up before you're in trouble. So, if we think of a red light as whatever symptom or moment would bring you to like a complete halt, that's your red light. And so we're trying to tune in and say, okay, so what happens before, let's say you enjoy walking and you're having hip pain, and your hip pain at a certain point stops your walk. So what actually starts to happen before you get the hip pain? What can you feel starting to come up? And it may not be in your hip, it may be in your shoulder, or it may be in your foot. I had quite the experience with this last year when I was reintroducing running and realizing that all of these things that I was feeling that I thought were just like, oh, I just shoved them to the side, were actually my yellow lights to my hip and back pain that I was starting to experience when I was running. But because I was feeling things in my ankle and in my opposite leg, I kind of just threw them off. But once I started tuning into them, I was able to um, schedule my runs in such a way and balance between running and walking that I wasn't getting myself to that pain point. And so that's why the yellow lights are so important, because they help us to realize what's going on and what is happening before the pain starts to come in or the symptom that we're dealing with. So once we've kind of established those yellow lights, we've started to work on your and improve the movement patterns. We have to build stamina around those patterns. And that's where, in building the stamina, is where you start to feel better for longer and longer periods of time. So we kind of get like a glimpse of like, ooh, okay, I feel better after I do these movements. And then things slowly come back down, and then you continue to work on the movements. This is where I said it's an active process. So you're working consistently on the movements, the breathing, the stillness, so that those patterns start to become more established. And then as those patterns are more established, you feel better for longer. With that, we start to grow the complexity of what you're doing while you're respecting yellow lights. So we continue to tune in on more and more subtle layers and levels, so that as you progress in your movements, especially depending on what your goal is, as we get you closer to that goal, we're still paying attention to the yellow lights, but we're moving things along. And so I think this is where we could have an impact when we're talking about the histamines and the exercise. It might be a process of really peeling the exercise or the movements back and starting to tune into the yellow lights of what you're feeling and what's happening in the body, and then starting to slowly introduce more movement. That, I think, would be my approach in that situation. And of course, we're always assessing and refining as we go along in this process. So is what we're doing actually working? And if it's not, then we change gears and then we assess again, okay, is that working? And so again, yeah, I think this, looking into the yellow lights, what is happening prior to the symptoms coming up, if we can start to play and have an impact there. And so it might be starting even before movement. We might come far back to breath and stillness, and some really, really easy movement. I hope that helps. And if not, we can provide some more. Let me know if you need some more clarity around that question. And we can dive into that. And then ultimately, through this process, we kind of keep going back and forth. Then we reach your goal and we have a big party and we cheer because you did it. So you might be wondering, how does all of that build resilience and vitality? And as we peel back the layers, and then we start to rebuild a solid, functional, harmonious foundation, we build you back up so that you start to feel better. And as you're tuning into these yellow lights and what's happening, you gain this. That's where the vitality and resilience comes in. It's a piece of feeling, I think it's a piece of that empowerment, and also feeling that, you're physically feeling better and that you can move forward with the things that you'd like to do. And so I've kind of alluded to this graph a couple of times, but what we've got here, and what the text is talking about. So as we tune into those yellow lights, as we feel more, as we become more aware, there's kind of this like up and down line. So let's say day one, and this might not really be days, it might be weeks, it could be months, depending on what we're looking at, but the general trend is the same. So, if you come in and this is kind of your status quo on day one, and we do some movement, you start to do your practice at home, you're like, wow, okay, I'm starting to feel a lot better. And then what you'll notice at some point, you'll start to slide back down, and you'll kind of start feel yourself go back to that status quo. Maybe even you go below status quo and you start to feel terrible. And as we explore those kind of in betweens and what's actually happening, we're able to intervene more quickly and with more accuracy, to help you feel better. So, an example of that might be your exercise program. So, the program that we put together, you start to work on it, and after the first day, you feel great. And then you notice that the relief lasts for a few hours, and then you start to slide back down. And then you can start to see, okay, so what are the yellow lights that were happening there? Okay, in that time, I had to do groceries, and then the dog got out. So I had to all of a sudden run for the dog, and, my computer crashed. So we were like, okay, so these were the things that were happening around you. And then what did you start to feel? So, okay, I started to feel my shoulders tighten up. I started to feel XYZ, and we got back down. And then we can put practices into place that help you get back up to that place where you're feeling really good. And as you build stamina, you start to spend more and more time in the upper echelons where you're feeling good. And then eventually, we like to get to this point where you're actually spending more time feeling good than you are feeling not so good. And rather than letting yourself drop all the way back down to where you were on day one, you've got all sorts of tools in your toolkit that you can use to intervene as you kind of slide back down, so that hopefully it's just a little, like these little blips here, rather than being a crash and burn. And if it is a crash and burn, then it's a learning opportunity, right? You still have the skills and the tools, and you can start to apply those again. Real life happens, and I think it's important to acknowledge that things aren't going to be perfect, but that we can use this to help us continue to feel better and better.
I think I was just going to say, Tamara, I love that, your examples of things that might get in the way weren't just always about the movement, because that's, I think, something that we see that a lot of people want to sort of blame. If they're feeling some more pain, they associate it a lot. Well, it must be because of the exercises that I'm doing. And it might not be. It might be related to all of those other events that have happened during that week that led to that. And sort of, and I think that's where you're sort of talking about how you sort of understand and learn what are these other contributing factors, that are these other whispers that contribute to how you're feeling, right?
Yeah, absolutely. And it can be things like, how did you sleep? How was how was your morning routine? Was your day thrown off by a phone call at 7 a.m. from a friend in need? And so everything got thrown off. Yeah. So it's all of those things, and we can really tune in and see what's happening, and then take the appropriate action. Because, like, Miriam, what you're saying, so yes, there might be a day where certain exercises are not going to be what your body needs, but rather you need XYZ, or you need some stillness, or you need to sit in a
Mhm.
warm bath.
Right.
So it can be all sorts of different things, and the more we tune in and pay attention, the more that we can start to understand when which stimulus will help us.
Yeah.
And yeah, so this is just, I think, a nice little summary. So when you listen to the whispers, you don't have to hear the screams. And
I love this quote.
it's so important. We see, I mean, Miriam, I think we see this so often with and I think this is just a very human thing, that we often don't intervene, we don't ask for help until things are really, really bad.
Yep.
And then they're really, really bad, and we're stuck in a not so pleasant situation. So if we intervene earlier, if we listen to what's going on, we can often avoid getting to that place where things feel really terrible. Now, of course, things like tripping and spraining your ankle, or like those things, again, still happen. But even in that process, I think if we're more in tune to what we're feeling and what's going on, then that recovery can be so different than if we're not listening to our bodies and we're kind of shoving everything aside. And so we've kind of talked about this. So feeling and awareness are superpowers. And developing that landscape of sensation helps us cue into the subtleties of what's happening in our bodies. So it's so much more than just feeling like this hurts, this is tight. We start to develop all of the in betweens. Is there a texture? Does it feel warm? What does it feel like before it gets tight? And that is so different for each of us. And this is where, excuse me, I ask a lot of questions and I have a lot of conversation and dialogue with clients so that we can help people feel this. And this is where we can thrive within whatever circumstance that we're in. And then you also get to make decisions about what comes next. And I think the best example of this was actually one of the trainers who worked with us during the yoga therapy program. And she talked about, she like goes to bed at like 8:30 or 9 o'clock every night. And she has a very regimented, like early morning schedule. And that's what helps her feel her best. She's spent lots of time figuring out what she needs to do to support herself. And um and then her brother was getting married, and she knew that, okay, well, I can either leave the wedding at 8 o'clock and go home and go to bed on time, or I can stay up late, eat the food I don't usually eat, but I'm going to enjoy my brother's wedding so much, even if it takes me a couple of days to recover on the other side of it. So she made a choice about wanting to participate fully in her brother's wedding, knowing that she might not feel great for the couple days after. And then she scheduled how she could take care of herself after so she could get herself back on track. And I think that's really important as well. Within all of this, you get to make your decisions, and then you get to you get to choose, like, yeah, okay, these are my yellow lights, am I listening to them today or am I not? And if you blow through your yellow lights and you get to a red light, then you can make that decision on what you do to take care of yourself or how you take care of yourself. And it's like becoming a fine-tuned race car driver. So you know when to accelerate, when you can really push yourself, when you can run through that finish line, and when you need to pull things back a little bit, when you need to take an evening to yourself or have some quiet time, and really how to support yourself. So I wanted to share just with you a couple of quick client success stories, and just so that you can get kind of an idea of who this can help. So a client who, and I kind of mentioned her at the beginning, so she was looking to return to running after having her kids and after experiencing some pubic symphysis pain. So really uncomfortable. She couldn't run very far without getting that pain. She was having some issues as well with some incontinence and just some pelvic pain as she was running. And she didn't actually think that yoga therapy would help her, but she decided to give it a try. And when she came in, she was all about needing to fix her posture and improve her posture. And rather than improving her posture, what we did is we started to work on the relationship. So, what was going on? We did some breathing, we did some core work. We were looking at how was she actually transferring her weight from her feet. We started on the floor with exercises. We eventually got her into standing, and she was able to run and is still running pain free. So that was really awesome. And she was surprised. I remember the message from her. She said, I really did not think that any of this was going to help or work. And here I am. She ran her fastest time that she had ever run, even from before her kids. So she really felt successful in the process. Um, and then another client who, again, I mentioned at the beginning, she actually came to see me for some hip and low back pain, but also mentioned that she had this upper back pain that had been there for about 13 years and she just could not get rid of it. And she didn't think that we could change it. It was just kind of an afterthought. And so we started by working with her hips, working on her low back, simple movements. Again, we started on the floor, we worked our way up, and she has now been without that pain in her upper back for quite some time, and she is feeling more energized. She told me the other week that she can do more than she's been able to do in a long time. So though she had specific goals that we did reach, she feels more energized and she feels like she can actually move through more. She can do more in her day, which she loves to be able to do. She's not one that likes to rest. So those are just a couple of examples of people that I have worked with that have had great success. So let's take a moment to check in. Are there any questions, comments? Anyone have anything there?
No, and I think from our perspective, the physios at the clinic who, we share clients with you that, there's a really nice complement between what we do as physiotherapists and the work that you're able to do with them. I have a few clients that, see me for certain things, but then work with you on sort of that connection of the breath to the movement and finding that sort of letting go of tension where they don't need it. So
Yeah.
mhm.
Yeah, I think that's great. And that is another, I didn't specifically include that, but I do often get asked if somebody can see me while they're seeing another healthcare professional, whether that's physio or an osteo or massage therapist and or a chiropractor. And yes, always, because I think that there's a real benefit, especially for certain people, if they're dealing with certain issues, to get that hands on or other modalities that physiotherapy, osteo, massage can offer they're not within my skill set. And then what we can do in yoga therapy is help you to solidify those changes that have happened in the tissue after, if Miriam's given you some hands-on work or done acupuncture, we can come in with some movements that will help to solidify that in your system. And then you're just like skyrocketing and feeling so much better, which is amazing. Because as much as we like to see our clients, it's really nice when they feel better too. So, okay, so we're going to do just a little brief exploration here. So I'm going to stop the share so that hopefully I am big on my screen.
there's somebody who actually did something in the question and answer, and this
Okay.
may be something that you're going to address maybe at the end. They're asking about the 2 upcoming programs, the intro to yoga therapy and the meditations, I guess, the probably the yoga
Yes.
nidra. Yes.
Yes, great. We'll be talking about those next. Perfect. So I'll go over the details with you. So I wanted to just take you through a really quick exploration of some noticing and growing awareness. Of course, a lot of what I do is working one-on-one with people, and I can't even see you. So so we'll just do something really nice and easy so that you can kind of tune into your own self. So I don't want you to change anything that you're doing right now. I just want you, either with your eyes open or your eyes closed, just to notice what you feel in your body. And nothing is wrong. So there's no wrong answer. Now, you don't have to share any of this, but there's no wrong answer. But just notice what is happening in your body. Are there any areas that are kind of talking to you? Notice your breath. And then hopefully you can see me large enough on your screen. I'm going to have you lift up your left hand, if you'd like to follow along, of course. And you're going to follow my movement. So I'm just going to be moving my hand around the screen, and you'll follow along with me. And I'd just like you to breathe as you do that. So breathing in and out. And there's nothing specific that you need to worry about with your breath. You're just going to breathe. And then let your hand settle on your chest. And again, with your eyes open or your eyes closed, just notice what you notice. How does your breath feel? Are there any specific areas that are talking to you? And then we'll bring both arms to cross the chest. And you might need to scoot yourself just a little bit forward on your chair and have your feet flat on the floor if that's possible. And then just start to gently turn from one side to the other side. And I want you first and foremost, to move within a range where you don't have any pain. So see if you can stop before any pain starts. And then notice what you feel. So you'll keep moving back and forth a few more times. Can you feel your rib cage moving, twisting from side to side? Can you feel your pelvis? And is it moving or is it still? Can you feel the chair underneath you? If your pelvis is moving, can you shorten the range and move within that twist where the pelvis stays still? And then bring some focus to your legs and notice again. So are your legs moving, first of all? And if they are moving, can you reduce your range just a little bit and move where the legs can stay still, where they don't have to go anywhere? And then bring yourself back to stillness. And just take another moment to notice what you feel. And again, remember that there's no wrong answers here, just whatever you feel is whatever you feel. And then you can just let yourself relax. And so that's a little bit of what we're doing, a little bit more of an experience. Again, it's hard because I can't see you, so I can't give you feedback. But when I'm working one-on-one with somebody, those are some of the questions that you might hear me ask. In addition to giving specific feedback or asking specific questions about what you're feeling based on what I'm seeing in your body, in your movement, and then we kind of go from there together. So before we get into talking about the classes, were there any questions, comments, anything that anyone wanted to share on that? Okay. All right. So hopefully I've answered some of your questions about yoga therapy and you have a little bit more of an idea of what it looks like. And again, it's a very individualized process. So it does look a little bit different for each person and depending on what your goals are. So a few options for you if you're interested in exploring further. Private sessions. So a one-to-one session with myself, and this can be done virtually or in person. I've been teaching now online one-to-one since last March. So I am very comfortable with it. I'm very confident that we can get you the results, whether you're able to come in person or whether you would prefer to be online. And then if you're leaning toward private sessions, but you still have some questions and you'd like to figure out if it's actually the right fit, get in touch with the clinic and book in a free 15-minute consultation. We can do this over the phone. We can do it video. We can chat more. It wouldn't actually involve any treatment, but rather it's just a chance for you and I to connect. And we can see if we're going to be a good fit, if yoga therapy can help you. And if I don't think yoga therapy can help you, then I'm happy to refer you to other services that will help you reach your goals. And then the two offerings that were mentioned. So we've got a yoga therapy group class coming up, as well as yoga nidra. These are both running through June. So the yoga therapy group class is a 4-week virtual class. And it's Tuesday mornings at 9:30. And each week we're going to be exploring kind of a different area. So we're going to do 1 week where we explore shoulders, another week where we explore hips. We've got a week where we're going to be looking into breath and core, and then kind of how we put all of that together. So we'll be breaking down, for instance, the shoulder week. We're going to be breaking down shoulder movements. Which ways do our shoulders move? How do your shoulders feel when they move? What kind of yoga poses or movements is that incorporated into? And that's kind of what each week will look like as we're exploring that area. So that starts next Tuesday. And that class, we will be getting on and off the floor. There will be some props that we use as well, but just props that you can find around your house. It's unlikely that you would need to go and find anything outside of the home. And then we've got a 4-week yoga nidra group class. So yoga nidra is a type of meditation, and there's several schools, but the school where I have my training through, they developed this system to help people recover from trauma, to deal with chronic pain, to help overall relaxation of the body, and also for people to kind of process any difficult emotions that they're dealing with. So this class will be more of an introduction to yoga nidra than a deep dive. Um, and what it will consist of is 15 minutes of optional, really gentle movement that can be done either in seated or on the floor. And then a 30-minute meditation. And in the way that I teach yoga nidra, and where I did my training, you can move during the practice. So we do ask, we kind of set you up in a comfortable position at the beginning of the meditation. But if you need to move at some point throughout because you're in pain or you're getting uncomfortable, then you're welcome to do so. So that is the yoga nidra, and it's a really, really beautiful practice. It's great to help with relaxation and feelings of anxiety and stress. It's a big one there. So does that answer? Are there any other questions about the programs? Okay, I'm going to do a last call for questions.
And certainly if you think of questions after the fact, then, just pop us an email and we'll be able to help you out for sure.
So yes, as Miriam said, so if you have any questions, please feel free to get in touch with either the clinic, or you can get in touch with me directly, Tamara at Fit for Life Physio. I would invite you, if you are on social media, to follow myself and the clinic, and Fit for Life Physio at gmail.com. That's the clinic email and the clinic phone number there. So if you're interested in registering or booking an appointment with myself, so any of the classes or a one-on-one, then again, you can either contact me directly or call the clinic. If you know that you want to register, or you know that you want to book something in, I would suggest calling the clinic directly. If you have a question, or you're looking for, maybe need some more specifics before going forward, then you can feel free to get in touch with me, and we'll get you an answer. So that's a wrap. Thank you so much for coming and listening. And I do hope that you've gained something from this, and that I'll have an opportunity to connect with you in the future.